Don't know the last time you went to A&E, but if you did turn up at a hospital, whether it was with a heart attack or maybe some sort of, problem with your leg or something like, maybe you understood the process of being triaged. You go in, you sign in, you say what you've got a problem with, and then you get assessed by a nurse or a doctor who then decides whether you're a priority or not. Well, it turns out that Wes Streeting, the Health Secretary, has actually had to tell the NHS to prioritise emergency treatment for the sickest patients this winter. Why? He wants to prevent people dying unavoidably in A&E corridors. He called an urgent meeting yesterday with the NHS Chief Executive, the utterly hapless and useless Amanda Pritchard, and with hospital and ambulance leaders to address the obvious winter crisis. We know it's going to be a winter crisis because it's winter. That means we're going to have a winter crisis. And basically said, you need to prioritise the people in the greatest clinical need. Imagine having to tell that to the people who run hospitals in this country. Let's talk about this with Dr John Puntis. He's co-chair of Keep Our NHS Public and a retired consultant paediatrician. John, thanks for joining us. Would you ever have needed to do that when you were in your job, to be told to prioritise those in greatest clinical need?
Hello, Julia. No, I mean, it's absurd in many ways, and it's what staff are doing all the time. But of course, they are really struggling to provide services, as you know, and we've discussed this before many times, but if you look at accident and emergency, you can't get sick patients out of accident emergency into the beds when they're ill enough to require admission, and it's estimated that 14,000 of those patients are now dying avoidably each year. So I would say to Wes Streeting, look, you're now in charge of the NHS. The Tories may have wrecked it, but you're now in charge. You've got to come up with plans that are actually going to improve services, and you actually need to prioritise the care of the most sick patients.
Well, the thing is, again, you can't treat more people getting them into A&E. We were told, we did a story yesterday about ambulance service in the West Midlands saying basically, if you're having a heart attack, get yourself to hospital because the wait for an NHS ambulance is going to be too long, which is mind-blowing, in those circumstances. You can't get people into A&E to treat them. You can't get those people already in A&E be treated to get into a ward until you've got the people on the wards already out, and that requires social services to work. You've got this circular system which is just abjectly failing. But everyone keeps forgetting about the social care side of things, which keeps people in hospital when they don't need to be, and it means more people go to hospital when they shouldn't need to.
Absolutely. And, about 1 in 7 beds, as you said, are full of patients now who could go home. They're medically fit to go home, but there isn't community support. And so there's been nothing in the NHS consultation, and probably nothing in detail in the 10-year plan coming out next spring about social care. And this is a huge omission, which really does need rectifying.
Do you have any hopes at all that this Labour government, I'm sure you prefer a Labour government to a Tory government, given your campaign, Keep Our NHS Public, not that people were trying to not make it public. I'm not sure whether that's the right way to go about these things these days anymore, but do you have any hopes that Labour are going to be able to do this, improve things?
Well, firstly, we campaign for a publicly provided NHS based on its founding model, and we were set up when the last Labour government was in power because we didn't think they were doing a great job. Actually, the current government could learn a lot from the Blair-Brown government because they did invest more in the NHS.
They spent more.
They reduced waiting times and public satisfaction went up. And the ONS analysis of what happened under that government was that it was the investment in the NHS.
I think we have to be clear, we spent an absolute fortune more, and that saved more lives. However, we still had, at the end of the Blair-Brown years, an NHS, a publicly run system, where your chances of surviving a heart attack, cancer or any chronic disease was still lower than all of the other systems that aren't run on the NHS model in the rest of the Western world, which is perhaps a bit of a giveaway. Maybe the model is the problem. John Puntis, we'll have to leave it there, I'm afraid. Time is against us. Co-chair of Keep Our NHS Public. Sam Armstrong, I'm a big fan of Wes Streeting. I think he's sharp. I think his heart's in the right place on this. He's willing to talk the talk. But if you have to tell the NHS to prioritise the sickest patients, something has gone horribly wrong.